Welcome everyone. I am Sambardhan Dabadi, Biomedical Engineer from Annapurna Neurological Institute and Allied Sciences. Today I'll be discussing on the topic electroencephalography. I'll be discussing on how is EEG done, what are the systems required for the hardware and the software for the acquisition of the EEG signal. Talking about the EEG, EEG measures and records the electrical activity of the brain. As you know, the brain cells or the neurons have positive and the negative charges between them. So separation of positive and negative charges create a potential difference across the neuron. Such potential difference can be acquired using an electrode placed at the scalp. Such electrode amplifies and filters the signal to produce the EEG waves. Such EEG waves are small and low in amplitude. Such signals have to be amplified and proper filters are for the acquisition of the EEG signal. The basic requirement for the acquisition of the EEG system requires a EEG machine which consists of the acquisition box, amplifier, and the software. Usually, acquisition box and the amplifier are combined within a single unit known as the head box. The software are supplied in a desktop or a laptop. The recording scalp electrodes are connected to the amplifier at one end, while the other end is placed at the scalp of the patient. The impedance gel or the electrogels are used to reduce the impedance of the scalp and the bone. This is the basic system or the head box shown in the diagram. The head box consists of the amplifier and the acquisition box and filters within it. This can be either 24 channel or 32 channel based on the system used. Such electrodes are placed on the scalp and then connected to the amplifier which collects the EEG signal and then are transmitted to a software in a laptop. In the past, EEG machine used to be bulky and they used to cover up a single room. But nowadays, the modern EEG machines are quite compact, they are portable and smaller in size. Electrode placement plays a vital role in the acquisition of proper EEG signal. Based on the channel of acquisition, electrode placement may vary, but the commonly used 24-channel EEG placement is as shown in figure. This is the schematic diagram in which different parts of the skulls are represented using the different electrode labels. The different electrode labels can be FP for prefrontal, F for frontal, P for parietal, T for temporal, O for occipital, C for the central. The left and the right hemisphere of the brain are separated using the numbers. Usually, even numbers are used for the right hemisphere of the brain, while the odd numbers represent the left hemisphere of the brain. In the schematic diagram, we can also see the suffix Z. The suffix Z represents the central or the midline of the brain. In common practice, CZ and FZ are common reference points for the acquisition, while in the monopolar montage, A1 and A2 are the contralateral references for the left and the right hemisphere, which are usually placed on the left and the right earlobe, respectively. There is a standard system for the electrode placement, commonly known as the 10-20 system. The 10-20 system describes the accurate position of the electrodes to be placed in the scalp. For the proper positioning, the scalp or the head is divided into three major measurements. The first from anterior to posterior, that is from Nazian to Inian, in which the midline electrodes are placed at an interval of 10%, 20%, 20% respectively. The first electrode FZ is placed at 30% the distance from Nazian, at 20% from FZ, CZ is placed, and 20% from CZ, PZ is placed. After the PZ, 20% distance is left for OZ electrode. Secondly, the preauricular to preauricular distance from left to the right earlobe is measured. Along this measurement, T3, C3, CZ, C4, and T4 electrodes are placed at a distance of 10%, 20%, 20% respectively. Thirdly, the skull circumference is measured with a reference point marked as Nazian and the Inians. Along this point, FP2, F8, T4, T6, and O2 are placed on the right side, while FP1, F7, T3, T5, and O1 electrodes are placed at the right side. For this, the interval of the electrode placement are 5%, 10%, 10% respectively, as they are measured from the midline. During the placement of the electrode, the technician uses electrical impedance gels to attach the electrode to the scalp. The impedance gel are used to reduce the electrical interference and the impedance of the skin and the skull. The placement is done based on the 10-20 measurement system. As we have talked about the impedance of the skin and the skull bone, impedance is the opposition to the flow of electrical signal. In EEG, signal is generated at the cortex of the brain and is received by the electrodes placed on the scalp. Between the cortex and the scalp, there are tissues such as meninges, bone, skin, hair. So such tissues provide an impedance or obstruction to the flow of signal from brain to the electrode. Such obstruction is commonly known as impedance, and to minimize the impedance and the resistivity, conductive gel is used during the electrode placement. The impedance measurement system can be used to check whether the electrodes are placed properly or not. Until the signals are green or there are certain values specified, the impedance has to be checked. If the system shows open, then we have to know that the electrodes are not properly connected or either the electrodes are damaged. During EEG, we can acquire five different kinds of signal ranging from 0.1 Hz to 100 Hz. The signal amplitude ranges from 2 millivolt to 200 millivolt. Such signals are classified as delta signal between 0.1 to 3 Hz, theta signal between 4 to 8 Hz, alpha signal between 9 to 14 Hz, beta signal from 15 to 30 Hz, and gamma signal from 31 to 100 Hz. These signals are acquired based on the concentration and the activity of the brain. The acquisition of the EEG signal is commonly known as the montages. There are various montages available for the recording of the EEG, but the commonly used are the referential montages, also called as monopolar montage, and the bipolar montages. In referential montages, the active electrode signal is received based on the ground electrode signal. For example, if the signal is acquired between FP1 and A1, this records the signal of the FP1 cortex of the brain with reference to the ground. Similarly, the bipolar records the activity of the brain between two active areas of the brain. For example, O1 and O2 combination records the activity of the left occipital lobe in reference to the right occipital lobe. Here we can see a longitudinal bipolar montage where the electrode combination is from anterior to posterior of the brain, creating a banana-like structure also known as double banana montage. Similarly, transverse bipolar montage is also available in the software where the combination of electrodes is from the right to the left or left to the right. Similarly, in monopolar montage, the active areas of the brain are recorded with reference to the reference of the ground electrode placed on the earlobe, which is commonly A1 or A2 for the left and the right ear hemisphere of the brain. The signal acquired for the EEG are too small and difficult to interpret. To make the signal readable, various filters are to be set up. Some of the parameters that had to be set for the proper signal acquisition are amplification, filters, page speed, and sensitivity. Talking about the filter, there are three kinds of filters available in the EEG software, commonly called as low-pass filter, high-pass filter, and the notch filter. The low-pass filter cut off the signal below the given threshold value. For example, if the low-pass filter is set at 1 Hz, then the signal below 1 Hz are not displayed, while the signal above 1 Hz are displayed in the graph. Similarly, if we set the high pass filter at 70 Hz, then the Signals above 70 Hz are not shown in the graph, while signals below 70 Hz are displayed in the graph. So, in common practice, we use low pass filter at 1 Hz and high pass filter at 70 Hz, which includes all the brain waves between them. So setting up the low pass filter at 1 Hz and high pass filter at 70 Hz creates a band pass filter which shows all the frequency ranging from 1 Hz to 70 Hz. Similarly, the third kind of filter is notch filter, which is used for the rejection of the electrical interference to the brain signal. In Nepal, we have the electrical supply at 50 Hz, so we use the notch filter at 50 Hz so that the electrical signals coming from the current supply or the power supply are omitted in the EEG signals. The sensitivity defines the height or the amplitude of the acquired signal. They are measured in microvolt per millimeter. The usual values can be 1, 3, 5, 15, or so on. The standard value depends on the type of acquisition box and the ability of the system to capture the signal. Here we have sensitivity values between 1 to 1000 microvolt per millimeter. As the sensitivity is decreased, at 2 microvolt per millimeter, the amplitude increases, causing the signals to overlap. Similarly, if the sensitivity value is increased to 75, the signals flatten, making it difficult to understand and read. So usually the standard sensitivity value is set at 7.5 microvolt per millimeter. The third parameter is the page speed, also known as the wave speed. This defines the length of the wave displayed per second and is measured in millimeter per second. Usually, the page speed value is set at 30 millimeter per second for the adult and 15 millimeter per second for the neonate patient. If the page speed value is set at 7.5 millimeter per second, the waves are concentrated and they are quite difficult to read. Similarly, if the page speed is set at 60 millimeter per second, the waves are dispersed and they are even difficult to read. So in usual practice, we set it at 30 millimeter per second for the adult patient and 15 millimeter per second for the neonate patient.